Welcome. My name is Kathy Shea, and I'm the Frederick County Senior Services Division Director. Today, I'm hosting a Medicare A workshop with Ellie Williams, who is the coordinator for the State Health Insurance Assistance Program. Ellie has worked for the Department of Aging for over a decade and specializes in Medicare information and assistance. She often travels throughout the county providing Medicare workshops. Today, we are recording this session so that Frederick County residents can access this vital information as their schedule permits via the website frederickcountymd.gov. Well, welcome, Ellie. I'm so glad that you're with us today. And I want to start by asking, can you tell us the difference between Medicare and Medicaid?
Well, that's actually a good question, Kathy. Medicaid is actually health insurance that's provided through the state of Maryland, and it is based on one's income, whereas Medicare is actually health insurance that's provided through the federal government for those who are 65 or older, those who are approved and are on Social Security disability for at least 24 months, those who are diagnosed with end-stage renal disease or Lou Gehrig's disease. With Medicare Part A, that's actually the hospitalization. It helps cover inpatient care in hospitals, skilled nursing facility rehab, which folks have to be inpatient hospital stay for prior to 3 days prior to going into the facility. It also helps cover hospice care, and limited home health care is attached to Medicare Part A. A lot of folks ask me, when should I enroll in Medicare Part A? And that can be kind of a tricky situation. It's based on one specific situation. If you're receiving Social Security benefits and you are 65, you will be automatically enrolled in Medicare. One of the things that I like to make sure folks know about, if you're covered by creditable health care coverage through you or your spouse's active employment, you will not be required to enroll in Medicare unless the company has 20 employees or less. If you're covered by COBRA, retirement health benefits, a policy through the healthcare exchange, or Medicaid, you must enroll in Medicare when you're first entitled. If you're 65 and still working, and you're not receiving Social Security benefits and you're contributing to an HSA, you will definitely not want to enroll in Medicare Part A. Most folks receive Part A premium free, and they must have at least 10 years of Medicare covered employment. There are certain costs that do go along with Medicare Part A. As for instance, the Part A deductible is $1,340 for days 1 through 60. Skilled nursing facility coinsurance is $0 for days up to 20 days and $167.50 for days 21 through 100. This is the part that a lot of folks don't realize. If you're in a skilled nursing facility and you have Medicare, your Medicare coverage ends on the 100th day. After that, Medicare will provide no coverage whatsoever. Inpatient hospital care and skilled nursing facility charges are also based on what's called a benefit period. The benefit period begins the day that you're admitted to the hospital and ends the day when you come out of the hospital or you leave the skilled nursing facility. And you have to be out of either facility for at least 60 days in a row for a new benefit period to begin. This means, yes, you would have to pay $1,340 for each benefit period. And there's no limit to the number of benefit periods per year. For example, if you go in the hospital in January and you stay for 6 days and then you leave and you go back in the hospital in May and you stay for a week, you would be responsible for the Part A deductible each time. If you were to go into the hospital in January and stay for 6 days and you're only out for 3 weeks and you go back into the hospital, you're not responsible for a new deductible during that time. There's no limit to the number of benefit periods, which means there's no limit to the number of times you may pay the deductible each year. And this wraps up our Medicare Part A session.
Well, thank you, Ellie, for that information. Now, I have a few commonly asked questions. So the first one is, should everyone sign up for Medicare A when they turn 65?
It's really going to be based on the individual's situation. I always tell folks that if you have at least 10 years of Medicare covered employment and you are still working or you have other benefits, there's no reason really not to sign up for Medicare Part A, as it wouldn't cost you anything, except for in one situation, and that situation would be if you are still working and you're not receiving Social Security benefits and you're contributing to an HSA, you would not want to enroll in Medicare Part A.
Okay. Well, how about, does Medicare Part A cover nursing home stays?
Medicare Part A only covers nursing home stays for rehab purposes. After 100 days of rehab, you are no longer covered by Medicare if you stay in the nursing home. So your coverage actually will end on the 100th day, as well as assisted livings. That's one of the questions that we get asked a lot of times. Medicare does not cover any part of your stay in an assisted living.
Okay. Well, Ellie, thank you so much for being with us today. We really appreciate your knowledge and your information. Thank you so much. Well, if you would like additional information about Medicare or you have other questions, please check out our other Medicare workshop videos. Also, you are more than welcome to call the Frederick County Senior Services Division at 301-600-1605. And again, thank you for joining us.